I think the main focus of the scheme was to try and help as many tenants as possible to maintain the tenancies, keep the tenancies, but also to help with the mental and physical well-being, to keep them out of hospitals, keep them out of prisons, and just generally help them in sort of everyday life, really. Make sure that they have a good standard of living within our properties. One of the biggest advantages through our service over quite a lot of services really at the moment is that we actually do home visits. One of the main sort of roles is to help them maintain a successful tenancy, and that's much easier if you can actually go out and see, one, the standard of the tenancy, but also it leads into, I find doing a mental health assessment a lot easier in somebody's home because you've got a lot more cues. You've got photos on the wall, you've got, you know, the cleanliness of the property, you've got pets, you've got children. There's a lot of sort of stimulus to ask more questions. And I think it aids engagement. I think it's a lot easier if somebody rings you up to say, I don't want to talk to you today, or can we rearrange? Whereas if you've actually knocked on the door and they've opened the door, I think it's a genuine, it genuinely increases the amount of engagement that we get with people. I think it helps that, particularly from the navigators, because we come from a background of the NHS, because we're not directly employed by WDH, we're actually employed by the NHS. I think people sometimes feel a bit more comfortable talking to an NHS worker rather than a WDH worker. I think it just gives them that little bit more trust and that little bit more that we're actually there to help. We're not there to manage their tenancy. We're there to actually help them maintain a tenancy and almost like be an advocate between themselves and WDH at times. So we do get the same level of training as our counterparts in the NHS. And it also opens doors to NHS services. Quite a lot of services won't speak to or won't share information with non-NHS services. So just having that sort of contract with the NHS, we can ring services such as Turning Point and things like that, and there's information sharing agreements in place. Obviously on a need-to-know basis and within the bounds of confidentiality, but quite often services won't share information with a landlord, but they'll share it with an NHS professional. So I think that's quite an important string to our bow, really. We have very good feedback, and like I say, I think the biggest impact is that people don't know what's available in the community. A lot of our tenants are quite vulnerable. They're in vulnerable groups, low-income groups. They don't have the funds and sort of the social connections to go out and find out what is available, what support's available out there. We work with quite a lot of people that rarely leave the house. So it's quite good to actually get in there and inform them, be that via leaflets, referrals, just talking to them and trying to get them more inclusive in the community. I think WDH is very good at that, regardless of with the navigators. We do have quite a lot of services within WDH that try and include communities rather than just individual tenants. I was quite surprised in a lot of ways just how much is provided to a WDH tenant and how many, you know, just for example, if somebody's struggling with the benefits, we have got a specific team who works with people's finances and support and looks for grants and helps them swap the energy providers and things like that. And that's, although that team now is, I believe it's been so successful that they actually work with non-WDH tenants as well now. So that team's expanded. But yeah, just the level of input that you would get as a WDH tenant that you wouldn't get as a private tenant.